Talk about the latest in the battle against COVID here and across the country. You know this, a big focus right now is on masks. In some states, school districts have been fighting against orders from governors that banned mask mandates, even as cases are climbing very quickly among children.
And at the same time, we also have the FDA expected to approve booster shots for immunocompromised people. So think transplant recipients, cancer patients, and others who might not have gotten the full protection from the first 2 doses.
So there is a lot to talk about tonight, and joining us live right now is Kaleida Health epidemiologist Dr. John Selleck, among our friends here on the show. Thanks for coming back on.
Thanks very much for having me again.
It's good to have you here, Dr. Selleck, and we mentioned this big fight over masking in schools. Duke University has a study out that found universal masking reduced spread in schools, but opponents are saying it's not needed because cases in children are less serious. So what should parents know about this, and what should they be advocating for their kids?
That's a great question, because I think that's exactly what they need to do, is advocate for their own children. We know that kids tend to do better, but if you let millions of them get infected, there will be some who get into trouble, who will wind up in the hospital. You will get a few deaths out of that, and you may wind up with kids who have other long-term problems, as we've seen with some patients who get infected. We have never really eliminated any disease by letting a pathogen run wild to get us to herd immunity. It didn't work with measles, mumps, chickenpox, smallpox, any of those. So I think that the layered approach that we talk about, having everybody wearing a mask, improving our air handling, air circulation in the classrooms, maintaining some level of physical distancing whenever possible. I think these are all things that are done to make it safe for our kids, and in my case, grandkids, to get back to school.
Yeah, it's certainly a debate and a conversation that's going to continue as this is changing really by the day in different states and in different districts. I also want to ask you about the FDA expected to approve these booster shots for immunocompromised people within the next day or so. I wonder if this is a sign of what's to come for the rest of us, or do you think that this is really just needed for those people at this point? Because we know, and we've stressed this a lot, this doesn't mean the vaccines aren't working, right? These are people who have kind of underlying conditions that make it necessary that at this point they may need these booster shots.
Right, this is absolutely correct, because what we're seeing is a progression of thought here. So if you look at these groups of very immunosuppressed people and the groups that are focused on, again, transplant patients, people with hematologic malignancies, leukemia and lymphoma, but also patients on dialysis, patients with primary immune deficiencies, and some of the other drugs like rituximab, make it very difficult for people to respond to these vaccines. So the Advisory Committee on Immunization Practices is meeting starting tomorrow morning at 11, and they haven't posted their slides, but they have posted their agenda, and it looks like what they are going to discuss is an extension of what they did in July, which is giving a 3rd dose of vaccine, not really looking at it as a booster, but this would be a 3-dose series for these groups of people. Now, we don't know exactly what groups, how tightly they're going to define who these are. Other things that they've said is that this will rely somewhat on the responsibility of clinicians and patients to sit down and discuss this. So presuming that this is going to go through them tomorrow, I think that the FDA action will probably come by pretty quickly after that. They also have one little item on here about on the agenda about discussion for additional doses for other people. So the fact that it's one item at the very end of the meeting, I think that the thought process is still that what we've done so far with the vaccines is working for the majority of the population. So I think we're going to see this stay in a position where there's going to be constant evaluation of what the data look like. And I think we all recognize that at some point in the future we will need additional doses, but I don't think it's going to happen for most of us just yet.
Always appreciate the information. Dr. John Selleck, Kaleida Health epidemiologist, thanks so much for being back with us.
Okay.
We so appreciate it.
Thanks again. Yeah, be safe.
Great to see you, Doctor. Thank you. And thank you, everybody, for joining us for tonight's Town Hall. A reminder that your questions and comments, of course, drive this show.
You can get in touch by using our text line 716-849-2220 and stay with us. Channel 2 News at 6 is up next.